from the toes, so heels and toes are starting together, and then take your heels out and then the toes out to match where the heels are, and then let the knees follow. So the knees are pointed up to the ceiling, our heels are in line with our sitting bones, knees are also in line with the heels and sitting bones. We're going to just rock the head side to side several times to relax through the neck. And then let your gaze come up to the ceiling. Tucking the chin under a little bit and letting it gaze come back up to the ceiling. We're going to find a neutral position in the cervical spine by keeping the gaze up to the ceiling and having a slight tuck to the chin as if you're trying to hold a large orange under your chin. Taking your shoulders and pressing them up towards your ears and then letting them come down a little bit, and let the shoulders relax and shoulder blades relax down onto the floor. Finding your neutral spine, we're going to start to rock the pelvis. So we're going to just rock so that the tailbone points down a little bit more toward the floor, and then pick it up so that you're imprinting the back down onto the floor and keeping the knees and legs steady during this. We're going to look for a neutral spine by taking the heels of the hands and placing them on your ASIS, which is the part of the pelvis that's jutting out right here on your hip, on your pelvic bones. And we're going to take the heels there and then press the hands down together so that the fingertips come over your pubic bone. I want you to mash your pubic bone down a little bit, and then again take that rocking motion, so pushing down and pressing up, keeping your shoulders and your hands nice and steady. And when you find a position that will have your fingertips and the heel of the hand in a nice straight line right here, as if you were to put a carpenter's level on your belly and it were to stay level, that's your neutral spine. So we're all different, and we might all be in a different place, but having that level position is going to be the way to go. So we have a little curve in the back, that's your lordotic curve, and we're going to tighten up through the belly right here. So as you tighten up in the belly, we're using the TVA, the transverse abdominis, to keep that motion nice and tight, keep the belly tight, as if I'm about to come along and hit you in the abdomen. You want to keep nice and tight and keep it braced. From there, we're going to breathe out and use your rib cage in all four directions to get the breath moving. And as you move with the breath, your abs are staying nice and tight. Continue bracing. Continue with that slight curve in your low back, that neutral spine. And you can keep checking if you like to make sure that you're keeping that. Opening up the rib cage, the chest, and even up into the collarbone area, and just breathing for a few moments. Getting used to holding the belly tight as you breathe. And then you can take the hands down to the floor. And we're going to just lift one leg up. So holding that nice tightness through the belly as if you're trying to pull your belly down away from your shirt, keeping that neutral spine here. And we're going to lift one leg up so that the knee is over the hip, and then place it back down again. And the other leg comes up and placing it back down. So this is the first of the neutral series, and we want to just get used to moving the leg from that hip without moving the knee really, and bringing that down, and the other side, and doing that with that low back curve, that lordotic curve in the lower part of your spine. So we're alternating the legs here. And then if it feels good to go on to the next part, if you're having trouble keeping your back in this position, you're going to keep with that. But if you like, you can come to both knees coming up. And again, make sure that you're still in that lordotic curve. So if you want to recheck, you can by placing the hands and just seeing if that carpenter's level would again stay still here. And from there, you can drop one toe and tap and bring it up. And the other toe taps and come up. So we're moving straight from the hip flexor here rather than the knee. So I like to refer to this as having our Barbie legs on. So you know Barbies can't move their knees at all. And just like that, we're keeping that lordotic curve while moving from the hip. And breathing. Still trying to get that full expansion of breath through the rib cage. And if it feels good, you could extend this leg out longer and pull in and out and pull in. And we're thinking about lining up our foot with the leg on the other side. And then bringing it in, and you can drop your knees into the chest, coming into a bit of a pelvic tilt here if you like, and maybe you rock side to side, which I realize is a very yogi thing, but I'm used to teaching yoga. And then you can bring your feet back down to the floor, find that neutral position again to be ready to move on to the next series. And that's it for now. Thanks.